You're smart, you're trained, you're experienced. So, why do even the most thoughtful health professionals get pulled into these sexy trends before they really fully understand them? Today, we're talking about how ideas hook us and why speed can feel like strategy. I'm Bruce Spurlock, a physician and healthcare leader committed to professionals and decision makers to navigate change and navigate it with clarity. On viral healthcare, we look at the ideas spreading across healthcare and what it takes to implement them wisely and sustainably. Let me start there. I know you're smart. You know you're smart. You didn't get this far along without a lot of training, a lot of discipline, a lot of education, and the ability to really think critically. It's what brought you this way and it's what made you successful. We're all trained to analyze evidence. We know how to weigh risk. We can make consequential decisions. And yet, even in healthcare, maybe especially in healthcare, we get caught up in, the hype, the buzz. We get drawn toward business words that kind of sound kind of interesting, toward these polished frameworks, toward new models that promise speed, efficiency, savings, transformation. That's that buzzword again. If we can just transform, we'll see nirvana. But it's not because we're naive, it's because we're human. It's not because we have healthcare under without constant pressure to improve. We do. So today, I want to talk about how new ideas actually hook us, actually get and grab us and make us want to join, whether we thought through it enough or not. Not because they're good or bad, but because that's how they spread. That's the idea. We're going to study spread and the rapidity of spread. And that's my first concept that I want to share with you today. There's this thing called the velocity effect. So some ideas move very fast. They're everywhere within months, weeks, sometimes even days. You see them at conferences. You hear about them on panels. I'm leading a panel today, and we're going to talk about things that sound kind of sexy, sound kind of exciting. You might see them in LinkedIn posts. Boards ask about them. And interestingly, some vendors, they lead with this new idea, with this kind of sexy sounding way to approach problem. Speed creates credibility. And when something spreads quickly, we assume that, man, if it's going that fast, it must be good. It's kind of like the first iPhone just exploded. And after that, they all had to be great. But one thing I want to point out today is that velocity is not the same as validity. So ideas spread for a lot of reasons, and they spread quickly for these reasons, like they solve a visible problem. They promise relief from a painful issue. They align with your financial incentives. And it's interesting, sometimes they even carry social status, or they just simply sound kind of sexy, kind of modern, kind of innovative. And we like that. We want to be around the cutting edge. Velocity is extraordinary. And it's the speed that creates the psychological pressure. Like, if everyone else is adopting this, as everyone else is doing it, maybe I'm falling behind. And that is a very, very powerful hook. So that's number one, the velocity effect. The second one is the pain point hook. So some trends, they don't spread because they're flashy and all that, sexy and all that. They spread because they attach or attack or are familiar with something that's really frustrating, a vexing problem that's been bothering you for a while, or maybe particularly bothering you in the recent past. Burnout initiatives are a really good example. Or care coordination redesign. How many times have you heard that? Because that's a real pain point, especially if you're in a medical group or in a health plan. How about value-based payment models? Yeah, that's getting at some things like we're spending too much money. How about documentation automation? I like that. I like this idea of ambient AI. So when something promises relief from a genuine burden, it becomes emotionally compelling. And when something's emotionally compelling, we're less likely to investigate it, to really evaluate it deeply. We want it to work. You want me on that wall, as the famous movie line said. And we want something that can soften our scrutiny and make it just easy to adopt. So that's number two, the pain point effect. The third one is what I call the authority signal. Really common. We see this all the time. Some ideas hook us because somebody important or somebody that we recognize is promoting them. A respected institution, maybe a national agency has done it with a lot of glitz and glamour and a big splash. A prominent CEO, a well-known academic, maybe even a celebrity has gotten in. The Kardashians, anybody? How about this? Authority creates safety. If a credible organization or credible person's backing this, it must be worth pursuing. And I'd have to say, often it is. I don't want to diminish many of the great things out there. Okay, maybe the Kardashians don't do the greatest things on promoting things for healthcare, but often in many cases it does. Authority doesn't eliminate implementation risk, it actually can accentuate it. So, the one thing to remember about the authority hook is even strong ideas, even worthwhile ideas, can fail in weak systems. Is yours a weak system? That's the question we're going to ask. Number 4 is what I call the career incentive hook. Now, most of you have a big career in front of you. You've got a lot of opportunity for moving up and doing exciting things on your professional journey. And let's talk honestly. Healthcare leaders are evaluated on action. You're not really evaluated on inaction, but what you accomplish. That makes us want to do things. Boards want progress. Investors, if you're in that kind of a setting, want innovation. Communities want reassurance. Regulators want movements. There's often more reward for launching something than for slowing it down. Let me ask you this question. You probably have seen with great fanfare a leader, healthcare leader, that's announcing a new direction the organization's taking. Lots of fanfare. Sometimes the fanfare is more than the content underneath it. But then have you often seen them stop and say, halfway through the process, you know what, this isn't working out. We're actually going in a different direction. Almost always, it just fades away. So we see big launches, and it sounds like we're doing great things. Announcing an initiative is visible. Evaluating readiness is super quiet. That dynamic matters. Sometimes trends hook us because that signals leadership is doing something, even if absorbing them is harder than anticipated, even if it's the wrong way to do it, even if it's the costly thing. And remember that. We're going to talk about that very soon. All right, number 5 is sometimes there are these trajectory patterns. That's what I call these trajectory patterns about how to think about a viral activity. And sometimes it's like flash and fade, a rapid rise, intense enthusiasm, and then this gradual quiet abandonment. I talked about that with some of the big flashes that healthcare leaders do it. But it's not only that, vendors do it. Others get this flash and fade trajectory. So lots and lots of excitement, the hard work, the persistence, the navigating difficulties and implementation, not so much discussion. How about the slow burn trajectory? So it has modest interest at first, but there's the steady adoption over years. Actually, that's kind of the most exciting. When you know there's steady adoption, slow and steady over the years, this is how things get embedded into standard practice. Not super sexy. The slow burn, it's kind of like the tortoise and the hare. The tortoise goes flash and fades because it gets too exhausted. The tortoise goes slower and gets there before the rest of the people. How about the rebranding loop? Ooh, boy, I bet you've seen this one. This is an idea that resurfaces every few years, but it changes the name just a little bit. So we're going to call it something different. It's still a change initiative. It's still something new and exciting. It's still going to transform the company, but it's a way of simply rebranding it. I sometimes see this happen when you get new leadership. When you've had somebody in the leadership of an organization for 4 or 5 years, new person comes along, somehow they got to make the organization theirs, and they go through this rebranding loop. It can happen for a lot of reasons. Here's one. It's called the structural shift. It's rare, but it's super powerful, a little bit akin to the slow burn. But when a concept truly reshapes the system and stays, we're going to have some of those examples, ones that don't happen very often, but the healthcare system is fundamentally different in the next 5 to 10 and still 20 and 25 years later. So what determined which trajectory an idea follows? So probably not just the evidence, probably not just the funding, but I would say readiness. Is your organization ready? Is healthcare ready for it? We've tried a lot of things for many, many years, and it's only recently that some of these things have started taking hold. What is it that really requires that readiness? Is it technological? Is it the types of people that you have in your organization? Is it just a fundamental willingness to put in the time and the effort because you don't have a bunch of distractions in front of you? Is it absorptive capacity? Is it cultural alignment? We'll talk a lot about culture and the very multiple meanings of that word during our podcast. It's this idea that everybody wants this cultural alignment, but what are they really saying? And mostly, is it operationally feasible? Can we do it with the resources or with a modest increase or restructuring of the resources we do? Is it operationally feasible? All right, let's go back to that first question I asked. Let's return to where we started. Why do smart people like you still get hooked with some of these ideas that may not be going anywhere or maybe shouldn't be going anywhere? So let's start again. You're smart, you're trained, you're super experienced. So what is it about the trends that still pull us in, that still grab us and say, you've got to take me and do me? Healthcare is complex. First of all, that's the most important thing. It's really complex, and we're always trying to navigate that complexity. And we often trying to simplify in the process of navigating that complexity. And a trend, especially one that's got well packaged, that's put together really well, helps us simplify and make complexity look a lot easier. And that's a danger sign because we're overloaded, because clarity is scarce. I remember a CEO once told me, you guys deal in 95% confidence intervals. And I just want something that gets me a little bit over 50-50 in my decision making. And clarity is scarce and predictability is challenging. So those are some of the issues. Momentum feels safer than just stillness. Watchful waiting is a term that people feel very uncomfortable with because they need to be doing. And it's not just physicians who are trained to do a lot. It's executives and other administrators that we've got to be doing something. We can't wait and watch and see this thing evolve. So the danger is not the enthusiasm. The danger is really unexamined enthusiasm. All right. So that's a lot in a relatively short time. I covered a lot of different things about why things go viral. We're going to peel some of this back over the next several weeks. We're going to show specific examples of trends and ideas and innovations that were adopted and then not so good. And I'm going to try to, from time to time, put them in the kind of setting of the real world, something that you might all be comfortable with. Like, for example, how many of you did Pokemon Go? I mean, it wasn't for me, but I know a lot of people were out on the streets one summer. Or the Ice Bucket Challenge. Some of these things, they're fun, they're worthwhile, may have a great purpose, but they're really short ideas and fads that kind of flash and fade, as we talked about earlier. So if this resonated with you today, this idea that gains momentum inside of you, that hooks you in, do a couple of things for me. First of all, ask better questions. Think about the question is sometimes the most important thing. One CEO really said, our job is to ask better questions. And so think about asking better questions. What does that mean? Invite different perspectives. First of all, ask people outside of your organization. You're going to hear this theme regularly on this podcast. Sometimes you might think you have all the answers and you just need to call on somebody, look somebody up. Most of the time, people will pick up. If you send them a message, they'll respond to you in a positive way. And consider what needs to stop before something new begins. It's the most difficult thing we need to do is stopping. They talk about in finance how people can buy stocks or buy things, and selling them is the more difficult psychological activity. And same thing in healthcare and in stopping these new ideas. It's the hardest part. It's not buying the new one, it's actually stopping it. And we'll talk a lot about that. So if you like this kind of conversation, if this is something interesting you, join me live each Tuesday on LinkedIn, or you can subscribe to Viral Healthcare on your favorite and preferred podcast platform. So also on Fridays, I'm going to be giving a 5-minute reflection about this week, this topic. I'm going to dive deeper into understanding how the week went and what did you adopt, adapt, or let go of. And we're going to look so much more over that 5 minutes. I'd also love to hear from you. What trends are gaining traction in your organization right now? Do you have a great example of a leader who stood in front of an audience and said, we're going to stop this because it's not working publicly? I'd love to actually talk with them. We're going to interview people along the way, and I'd love to have your recommendations of who you'd like me to interview. Okay, so the next podcast of Viral Healthcare next Tuesday, we're going to take a closer look at what could go wrong when you jump on a trend too quickly. What happens when you make a mistake? What are the costs, both obvious and sometimes hidden, when we think about doing those kinds of activity? This is what it's all about. As we continue, we're going to really start diving, into some specific trends, giving examples of things that worked and trends that didn't work so much. Why was it so sexy? Sometimes they have lasted 4 or 5 years before people have given up on them, even though they've made great efforts to make them successful. So, thanks for listening to Viral Healthcare. If this conversation was useful, share it with a colleague who's navigating change. There are a few of them out there who are doing that. And if you'd like more thoughtful conversations about ideas that are shaping healthcare, be sure to follow the show. So I'm Bruce Spurlock, and I'll see you next time.